Good morning, and let me share with you what I heard this year at the World Health Assembly on the very important subject of vaccine and immunization. You know, the World Health Assembly is attended by 193 delegates from the member states. And the immunization session this year covered the current progress internationally and within countries. Expectations for the decade of vaccines is huge. And plans for WHO to develop a global vaccine action plan to guide the work in the next 10 years is very strong. Well over 50 delegations and representatives of civil society took the floor on this very important item. For those of you who are not familiar with the workings of the World Health Assembly, this number represents an extraordinary level of interest and engagement. And I think a brief summary of these interventions from countries and civil society is a good way to give you an overview of what countries themselves see as progress and sources of pride. And it also tells us some of their deep concerns right now and for the future. Perhaps, taking reference from those interventions can give us some bearing on the important work that we collectively as an international community should do in the way forward. Now, many developing countries are proud of their ownership of the national immunization programs, and many of them, notwithstanding the very difficult financial situation, dedicated budget lines as a formal expression of their commitment. And as we enter the decades of vaccine, we heard about the great progress, and of course, we are happy also to hear about the praise for support from WHO and UNICEF, but especially for the Gavi Alliance. Gavi operates according to a fundamental principle that resonates extremely well with public health thinking in general, and the principle that guides the work of WHO, and that is every child, regardless of where it is born or the wealth of its parents, deserves protection with the best that science can offer. This is an expression of fairness and equity, and this is the principle that guides much of my own personal work. With Gavi support, I know Seth will be taking the helm soon, vaccines that prevent pneumonia and diarrhea, and the two biggest childhood killers, are now being rolled out in a number of countries. But these new vaccines are expensive, and sustainability is definitely a problem. And, as stressed by many speakers in the developing world. So this is one thing we need to pay attention. Now, as reported, many countries have added yellow fever and hepatitis B vaccines to routine immunization programs. And we also heard firsthand accounts of what the new meningitis vaccine developed in a project coordinated by WHO and PAV with support from the Gates Foundation, what this project means for Africa and its people. The vaccine was launched in December last year. The vaccine cost 50 cents a dose at a price that was demanded by ministers of health in Africa. The vaccine was launched in 3 hyper-endemic countries in Africa, in Burkina Faso, Mali, and Niger. Actually, Techi and I went there to launch that vaccine. And I'm happy to report to you, by the end of that month, meaning last December, close to 20 million people had been vaccinated in the 3 countries. And WHO and its partners are now currently assessing the impact of these vaccination campaigns, including the safety as well as efficacy of the vaccines. This is a very thorough and systematic assessment. The early results look extremely promising. For those of you who are not familiar with epidemic meningitis, this is not a big killer in Africa, but it is one of the most dreaded and feared of all diseases for parents. My staff in the field would tell me that the long lines for vaccination form at the first hint of an epidemic. It's interesting. People would even go into riot in order to make sure they get protection from the vaccine. For those people who are lucky enough to survive the epidemic, 25% of them are permanently impaired, either with brain damage or profound hearing loss. For once, ladies and gentlemen, for once, Africa is the first to receive the very best technology that the world working together can offer. Now, delegates in the World Health Assembly gave us two extremely clear messages. The first one is the achievement of ambitious yet fully agreed goals such as the expanded immunization coverage, the introduction of new vaccines, polio eradication, and measles elimination is directly tied to funds. We heard compelling pleas to finish, to support the Gavi replenishment so that recent spectacular progress can be maintained. And we should not lose that momentum. The second important message coming out is expanded vaccination coverage alone will not help countries to reach the Millennium Development Goals for young child mortality. Now, according to UNICEF statistics, we still have 8.1 million young children die in 2009 from largely preventable causes. This figure, on the one hand, is good. It is the lowest recorded ever in the last 60 years, and yet it is 8.1 million too many, far too many. So immunization is thought to prevent about 2 to 3 million deaths each year. Vaccines are magic bullets for those of us who truly believe in it. Yet, we must be sure that vaccines don't hit all the enemies that extinguish so many young lives. This is why we need to work so hard together. Countries remind us of the critical role of basic primary healthcare services and measures, such as oral rehydration therapy, home-based antibiotic treatment for pneumonia, and things so straightforward and yet so difficult for the poor as adequate nutrition, water and sanitation, and good hygiene. So the issue of sustainable funding came up over and over again. And as I have heard on many occasions, a vaccine that is too expensive for the developing world is worse than no vaccine at all. We need to reflect on this. Many ask the international community to find ways to reduce the cost of vaccines. Of course, that is important, but that is not the only solution. And of course, especially the new vaccines, which are much more costly. Now, delegates from the developing world refer to the need for technology transfer and skill training to enable them to make vaccines in their countries, including in Africa, of course. Some describe WHO's role in achieving exactly this technology transfer function. And it is important, and we will continue to do so. And of course, to support that, we also need other programs as well. Now, those are the sentiments and the comments coming from the Assembly in May. So what has happened since the May Assembly? In early June, I'm happy to see Serum Institute and Panacea Biotech agree to lower the prices for the pentavalent vaccines, which is important to protect against 5 deadly diseases. And GSK announced dramatic slashes in vaccine prices for the developing world, including close to 95% price cut on their new rotavirus vaccine. And this is important. On the 13th of June, donors or development partners pledged more than $4 billion to support the work of Gavi, an amount that exceeded anybody's wildest dreams. And I was happy to be able to take part in that very important meeting. This money will certainly hasten the introduction of new vaccines and expand vaccine campaigns in Africa's meningitis belt. And I urge you, Seth, please, to support the meningitis rollout in the other 22 countries that have not yet benefited. Now, of course, we also hear critics. Critics always cite the lack of basic infrastructure, health system weaknesses for delivering vaccines, and also the crumbling of public health services after years of neglect. throughout most of the developing world are major barriers that we need to tackle in order to scale up, the uptake of vaccines. Let me reassure the critics. The strengthening of health systems has really moved up to the top of the international health agenda, and it is a top priority for WHO. And the Assembly, this May, just for your information, adopted no fewer than 5 resolutions setting out the ways to build stronger health systems, and that, of course, extend to affordable services to the poor, including vaccines. This is, after all, how health operates in the context of MDG and their overarching goal of poverty reduction. By improving health, you reduce poverty. But to do so, we must reach the poor. If we miss the poor, we miss the point. This decade, ladies and gentlemen, this decade of vaccine has a vision. The vision always feeds that perennial optimism of public health that keeps us all going, despite the many obstacles and the setbacks thrown our way by policies and events beyond the control of public health. This decade will help realize the full power of immunization to prevent morbidity and mortality. And the young ones, the young lives saved from death and lifelong disability will be numbered in the millions. We have the technology, we have the resolve, and we have the determination. Together, I think we can do that. Thank you.